Good evening, Ayubovan. Assalamu alaikum. Welcome to all of you. I warmly welcome you all for today's webinar. This is the most expected and the long-awaited webinar that we are waiting for. So this is our fourth conference, which is organized by Aika about career progression in Dubai. This webinar will be focused and targeting about the DHA's MOH exams and its preparation. So for today's webinar, I warmly welcome Dr. Anju Priya, BHMS, Dubai MOH Qualified Physician, Managing Director, Triumph UAE MOH Coaching Center, Kerala, India. So we will have a discussion session after the presentation of doctor. So after that, you can ask your questions to doctor. So once again, I warmly welcome Dr. Anju Priya to host the webinar.
Okay, let me start.
Yeah, doctor, you can start.
Thanks, Dr. Wasima, for your introduction. Good evening, everyone. I am Dr. Anju Priya, working in Shanti Ayurveda Wellness Center, Dubai, as a homeopathy physician. Okay, so we can discuss about opportunities of TCM alternative medicine category. Am I audible to everyone?
Yes, yes.
Okay, thank you. Okay, so note that life has a alternative professionals in Dubai. So we can discuss each one detail. So facilities, job opportunities, and our coaching programs details also. So first, screen is visible to everyone.
Yes,
Yeah.
madam.
Okay, career progression in UAE for Ayurveda, Unani, Siddha and Homeopathy graduates. So note that in UAE, Ayush doctors is well paid. According to doctors' experience, salary will be more. So Ayurvedic doctors are in tremendous demand after clearing MOH theory examination in clinic itself, contacting the doctors. After only clearing the theory, clinic itself contacting the doctors due to that opportunity. Many new doctors, new Ayurvedic clinics are opening in UAE, searching for MOH licensed doctors and therapists. So after getting experience from newly joined clinic in UAE, they will provide commission also along with the salary. That in our clinic, Shanti Ayurveda Wellness Center, that only 9 to 1 duty, half shift, they given around 4,500 drams or more, 5,000 drams, Indian rupee around 1 lakh. So note that only afternoon. Then according to the experience, after they will give more amount of money also. Okay, newly doctors around only 9 to 1, half shift around 4,500 drams in Shanti Ayurveda, and many other Kotakal, other Ayurvedic clinic, salary will be more according to the experience, according to that your degree, PG, everything, salary will be more. Okay, so in Unani, doctors will get job in UAE government sector also. Yoga doctors also have good opportunity. In homeopathic doctors, salary based and commission based clinics are available. So most clinics are commission based. So that I mentioned about that Ayurvedic doctor salary and also clinic will give commission. That means commission means, so according to the patient number. So in one patient, that this percentage, so around 60 percentage commission in the doctors and 40 percentage for clinic, like that, according to the number of patient coming in clinic. Okay, then note the future in UAE. A lot of Ayush doctors are, in my knowledge, live comfortably with their family in UAE. Living in the UAE is an experience like no other. It has a Minister of State for Happiness and Well-being. No, seriously, the country aims to become one of the 5 happiest countries in the world. So, in fact, everything is gorgeous, from the man-made islands of the coast of Dubai to the world tallest tower, Burj Khalifa. Okay, so you can live well in UAE and many good opportunities also there, and you can lead quality life. Like there is no power cut and enough water supply, everything is there. Then how to, next we can discuss about how to prepare for the TCM MOH UA exam. Alternative medicine MOH UA exam. So USMLE, Davidson, Swanson family medicine. Mainly 3 textbooks are asking in exam. So we'll share the PDF in our coaching. Three textbook. This 3 textbook you should be read thoroughly. And also you need to work out all previous questions. Around 70 to 80% previous questions are repeating in exam. But going forward without knowing the concept, it will be difficult. Okay, so Swanson family medicine, sometimes same question has been repeating in exam, and also that USMLE key facts, Davidson important points are repeating. That same question around 2 year, 3 year, most of the questions are repeating. Okay, so it's easy to clear MOH theory exam because in our coaching, most of the doctors are recently also cleared. Around 5 doctors cleared July 20th exam. So it's easy only. Theory is not tough. So after clearing the MOH theory examination, same question that after, so note the point, TCM category, MOH, that alternative medicine category, Ayurveda, Unani, Siddha, Homeopathy, all are same question paper, no separate exam, MOH. So you need to attend oral assessment in, after clearing the exam. After clearing MOH theory examination, you have Viva. So that each stream separate Viva after clearing Viva. Each stream separate Viva. After clearing MOH theory examination, each stream, that Ayurveda, Ayurvedic Viva, Ayurvedic doctors are in Viva panel. So along with the medicinal part, they are asking Ayurvedic subjects also. And in homeopathy, homeopathy Viva. So theory, all category, same exam, no any different. Okay, Viva, separate question, separate exam, oral assessment. So the after clearing the theory, there is no difficult to clear the Viva. Usually 3 chances. Okay. So after each stream separate Viva, after clearing Viva, you will get evaluation certificate. Then you can attach within the clinic. No practical exam. Okay. Then exam model. The real exam, we are not writing the exam in online. We are answering the question paper itself. So you have to circle the correct option in the question paper, and you will not get the question paper back. 1.5 hour exam, 100 questions, including pictures also. Then around 75 questions MCQ type. Okay, so number will vary remaining according to time of question paper. Sometimes 75, sometimes 80, like that. Okay, so picture questions, note that you should write diagnosis. Okay, picture questions, you should write diagnosis. First, you should write the diagnosis. Then you can add more points also about the diagnosis. There will be space in question paper after picture. So note the point, MCQ questions, you will get only 1 mark, but instead of picture question, you will get 4. And some exam it is 2 marks, some exam 4 mark also. So picture question, very important. So some exam no picture question, sometimes it only 75 question also. So note that in exam no minus mark. Okay, no minus mark. Sometimes you may see same question twice. That's why that's importance of that question. You can see same question in twice. So you may get negative mark if you circle wrong one. That question only. That same question repeating in one paper. That number 1 the question and 20 also same question. So that time you circle the wrong option, you will get that question also
Excuse me,
only.
ma'am. Excuse me, ma'am.
Okay.
Your screen is not changing. Is that
Yeah,
okay?
cannot share. See this.
We can see the introduction to TCAM MOH UA coaching program. That only.
How to prepare for the TCM MOH UA exam details are not there.
We cannot see that.
Please wait.
We can see your PDF format.
Okay, okay, okay. Please wait. Now it is okay. Sorry. Sorry, please wait.
Yes, yes, visible.
Okay, how to prepare for the TCM MOH exam. So note that we already discussed about USMLE, Davidson, Swanson Family Medicine. These 3 textbook you should be read thoroughly, and also you need to work out all previous questions. Around 70 to 80% previous questions are repeated.
Excuse me, ma'am. Your mic is muted, ma'am.
Sorry. So note the USMLE, Davidson, Swanson Family Medicine. These 3 textbook you should be read thoroughly, and also you need to work out all previous question. So around 70 to 80% previous questions are repeating, but going forward, without knowing the concept, it will be difficult. So after clearing MO theory examination, same question for TCM doctor, that Ayurveda, Unani, Siddha, Homeopathy doctors all have same question paper. Okay. Then after clearing MOH theory examination, you need to attend oral assessment, Viva. Each stream separate Viva after clearing. So Viva, after clearing the Viva, you will get evaluation certificate. Then you can attach with it in a clinic. no practical exam. Okay, 3 textbook. So note the exam model. In the real exam, that we are not writing the exam online. We are answering the question paper itself. So you have to circle the correct option in the question paper. So you will not get the question paper back. You will not get the question paper back. Okay, so 1.5 hour exam, 100 questions including pictures. So around 75 questions MCQ type. Option will be the no will. So note that around 75 question MCQ type, but number will vary remaining. Number will vary according to the some question paper, and and remaining one is picture question. Around 75, if 100 questions in question paper, 75 MCQ and remaining one picture question. So picture questions, you should write the diagnosis first, then you can add more points also about the diagnosis. There will be a space in question paper after picture. So MCQ usually 1 mark, but pictures 4 or 2 mark. Okay, 4 or 2 mark in picture. Sometimes in 8 or 6 mark also. So picture questions are very important. Okay. Some exam no picture question. Sometimes it only 75 question. That we discussed around 100 question usually. Sometimes in some exam, each time exam, cut short the questions around 75 questions only from that time. We cannot predict that, but mostly 100 questions. So no minus mark. So you may see same questions twice. You may get negative mark if you circle wrong one. That I mentioned that second question in MCQ, second question and 20th questions are same. Okay, that prostate cancer metastasis to bone is the answer. So that same question repeating in 20th one. So you will get, so you will circle wrong option. Is there any blood or any lung, any other organ? So you will get negative mark, around 2 mark negative, because 2 times that question asked. Okay, that is the important, no minus mark. Sometimes also that importance of that question they are repeating again, that's why you will get negative mark. Other questions no negative mark. Okay, so no essay questions. Most of the previous questions are repeating, so easy only exam. Around 2 months will take to complete data flow process after submitting the documents, and you have 3 chances in exam. Okay, after first exam failed, you have 2 more chances. Okay, so you have 3 chances in exam. After third chance also failed, then after 2 years only you can appear for exam. So examination fee you need to pay in Ministry of Health in Dubai, that MOH site for data flow. Okay, so that exam questions are repeating, but some changes will be there, that repeated question. That's why you need to read the questions carefully. So you should know the concept, the disease detail. That's why we are discussing 3 textbook: detail, USMLE, Davidson, and Swanson Family Medicine. Sometimes Swanson Family Medicine, same questions are repeating. Okay, so also note that we didn't get the question paper back. So we will get the question paper from after that previously attended doctors. They are writing the remembering questions. Then only we can get the previous questions. So sometimes mistake will be happen because they are remembering and writing. So that's why concept should clear, disease knowledge. Okay, so you can familiar with the questions because most of the questions are repeating. So we have lots of question paper we are providing in coaching. Okay, then terms specialties. So we already discussed about that. Note the from coaching specialties classes on Google Meet. So if we have any problems in Google Meet, we can go on with the Zoom meeting. Then comprehensive coaching mainly based on 3 textbooks: Davidson, Swanson Family Medicine, and USMLE. So course duration around 40 days, but sometimes 45 days also will extend. So 2-hour classes from Monday to Saturday. Topic specific online exam will be conducted on Sunday. So Sunday exam, note that online exam you can attend any time as per your convenience. Okay, no need to attend Sunday. We'll give 1 week time. You can attend any time. So next, grand mock exam on completion of the course. So previous questions, grand mock exam conducted from trip after completion of the course. So note that weekly we are exam conducting. So exam after finishing the course also, Sunday will share the exam link, topic specific one. Okay, so after 40 days class also, some exams are remaining pending. So we'll share Sundays that exam. And last one is previous question exam, very important one. Most of our students are said it is very helpful for them for attending exam, and most of the questions are asked from that previous question paper that we conducted exam questions. So training from basic level to advanced level, a revision also is the, and past paper, that previous question paper discussions also will be there. Okay, data flow, you can contact this number. Then is there any doubt regarding anything, you can ask now. Any doubt?
Yeah, hello.
Yes, doctor.
Yeah, I'm Dr. Munir, and I just want to know now there are some people who have qualified from Pakistan with a diploma.
Okay.
So for them, what is the chances for to get into that UAE?
In UAE.
Yeah.
Uh,
So we have completed 4.5 years diploma course.
DHMS, sorry,
DHMS,
DMS.
yeah. DHMS, Diploma in Homeopathic Medical Science.
Okay. So that is no difference, I think. We'll get same salary. Some variation. Sometimes 5,000 dirhams, you will get 4,000 according to their clinic. Uh, they deciding that. So we cannot
Okay.
predict the amount.
Okay, thank you very much.
Doctor, hello.
Okay.
You said all we have just one paper. So does the question are based on Western, that means allopathy medicine?
Sorry.
Doctor, you said all we have just one exam paper, no?
Yeah.
So the questions are based on Western medicine or allopathy medicine?
No, pharmacology they are rarely only asking in exam. Some I will mention in our coaching some important allopathic medicine that usually rheumatological part management portion they are asking. We can discuss in coaching that detail about rarely 1 or 3 2 or 3 questions only asking in that pharmacology part. We can discuss in coaching. Musculoskeletal system, some osteoarthritis, some important diseases they are asking the management. So we know, for example, in rheumatoid arthritis, it is inflammatory disease. Osteoarthritis, it is degenerative disease. But osteoarthritis, for pain relief, they are giving non-steroidal anti-inflammatory drugs. So sometimes we confusing that it is non-inflammatory, then why we choosing this non-inflammatory, non-steroidal anti-inflammatory drug. But so we are in option we check a wrong one because we think like that because it is non-inflammatory, but usually pain relief in allopathic sector, osteoarthritis also they are giving non-steroidal anti-inflammatory drug. So like that important topic management asking very few only on 2 or 3. Then osteoporosis also very important management part because estrogen deficiency supplementation, then calcium daily intake 1200 milligram, vitamin D intake, all are necessary in osteoporosis. So some like that's like same like questions only asking in exam. Standard questions only management part, no details pharmacology.
Yeah, what is going to be the course fee for your coaching?
You can ask Dr. Saja.
Okay, okay.
But you can
How
tell
can we
or
join for the how can we join for the course?
Hello, doctor.
yes, no.
Yes, I am Dr. Nihar from Putlam.
Okay.
We are doing the government job in more than 15 years. We have the experience, more experience, and we have the more Ayurvedic surgical experience also. I am asking a
Okay.
question. Will they allow us without doing the MOH exam to practice there for the trial period
Doctor.
for 1 year?
No, doctor.
No.
You should clear the MOH theory exam because rules are very strict in UAE. So because in my in our clinic Ayurveda Wellness Center Dubai, so need many therapists because therapists only DHA licensed therapists are very few only. So but the due to that need some clinics are without license they are keeping the therapist, but one time the DHA they conducted some doctors are coming suddenly in clinic that from government sector and paid huge amount for that clinic without licensing practicing that doctor. So it is around case also will be there, so it's not allowed in without license practicing UAE and very
I'm
risk process.
Okay, I'm
Yeah.
asking, can we practice? Some are there, they have the license. We are going with, and then jointly, can we practice there without MOH license?
Without MOH license, you cannot
No.
practice because if the government knowing that fact, they will
Okay.
punish you. That's the issue. You can
Okay.
risk.
No trial period, isn't it?
Okay.
No trial period for the. We are getting ready from there, isn't it? We are going to getting ready from there for the MOH. So on that period, can we practice the exam as an apprentice or something?
So they are not giving like that for practicing only. Like that because DHA license they are not any clinical they are not taking risk for
Okay.
without licensing practice.
Madam, can we sit that MOH exam online from in Sri Lanka or India? No.
Sorry, because I am in Kerala and residing in UAE. So vacation only coming here and then go the. So it's Sri Lanka. Sorry.
No Sri Lanka, sorry.
Sorry, I couldn't
No.
come there.
Okay, madam. Okay, thank you.
Good evening, doctor.
No, doctor, no. Now,
Hello, good evening.
I just want to know.
Okay.
I have a question.
Yes, doctor.
Good evening, doctor.
Hello, yeah.
Hello.
Yes, doctor, you can say.
Yeah. Doctor, currently I am staying in UAE.
Okay.
So, if we follow the DHA exam, is it okay?
Yeah.
We can practice in Abu Dhabi, Sharjah, or any other
Yeah,
state?
okay. That's fine. MOH for all area. So DHA, so MO after clearing MOH, I am also cleared MOH and DHA licensed. How is that? So after clearing MOH theory exam, after clearing the Viva, you can transfer your certificate into Dubai, DHA and HARD in Abu Dhabi. So just data flow process. Okay. So in MOH for all Emirates.
Okay, so we don't want to sit for another exam for hard.
No, no exam, but DHA now recently available DHA, April only 22 April only started the DHA. That is oral assessment only, no theory for practicing in Dubai. But MOH you can practice everywhere and just data flow process. After evaluation certificate, you need to convert into hard. That your clinic doing that process. After joining a clinic, they will change your certificate MOH into hard.
You mean we have to join in like Abu Dhabi, then they will convert, or we have to join in Dubai and they will convert?
Yeah, like that only. After clearing MOH. But if you are clear the DHA, you can practice only in Dubai. So hard is not coming now.
Okay.
MOH for everyone.
Okay, thank you. Another question.
Okay.
So if I'm staying, if I'm a fresher, in
Okay.
data flow, they need like 2 years experience.
Yeah,
But after like a fresher, we don't have 2 years experience.
yeah.
So if we don't have experience, can we, like as that doctor asked, can we practice under another like senior doctor, and we can get I mean, we can sit for the exam. Normally,
So
pharmacy exam they are allowing, no?
yeah, that's that. You can get certificate from your native place doctor. That is there any doctor working in Sri Lanka? You can they can give you certificate, but you can't practice without license in Ayurveda. In assistant doctor also that they are not allowing. So if you are just no, you are fresher. If you are familiar with any doctors in Sri Lanka, they can give 2-year experience certificate to you, because in MOH data flow they are checking passport front and last page only. So there is no clue that you are living in Sri Lanka or you are in UAE or like that. Only checking the front and last page.
Okay, it means like I'm staying 2 years here, and
Yeah.
but I will take 2 years experience later from Sri Lanka. It will not be a problem for me?
No problem. You can.
Okay.
Okay.
Okay, thank you, doctor.
Okay.
I came once for your Ayurveda center.
Ishadi Ayurveda?
Yeah, I'm staying in Dubai, doctor.
Okay.
So is it easy for me to do the data flow, because I already started?
Okay.
And I can join the coaching with you?
Yes, sure. You can join.
Okay, doctor.
Okay.
Hello, ma'am. Can you hear me?
Yes,
Hello.
doctor. Yes, doctor.
Okay, ma'am. Now I'm from Sri Lanka, and I
Okay.
really need to know this. Now, what are the basic qualifications that we need to apply for this MOH clearance exam? The qualifications or the things we need to fulfill. Rather.
Okay. So you need a BAMS or BHMS, BUMS degree certificate,
All
then
right.
2-year experience certificate.
Okay.
Then also you need BLS certificate, basic
That is basic.
life support certificate.
Oh, I see. So,
Okay.
this 2 years working experience license, that is what you said we can get from our native country if
Yeah.
we live there. So
Yeah.
that from where do we have to get that BLS certificate thing?
BLS in you are residing in Sri Lanka only.
Yeah. So from there we can take it, is it?
Okay, will inform me about that. I think Dr. Saja informed me no Sri Lankans are will so basic life support in our Kerala all hospitals are providing, and UAE also that health center Dubai many hospitals are providing. It is a 1-day course only. So
I see.
after yeah.
Right. So
Hello,
ma'am,
madam.
Oh yeah.
Yeah, madam. Yeah, I'm Dr. Nihar. One more question.
Okay.
Is it possible to apply for the MOH exam from Sri Lanka, and after we are applying from here and coming there and we do the exam? Can we set the exam?
Sorry, please. Pardon?
Is it possible? Is it possible to apply from Sri Lanka for the MOH exam?
Yeah, sure, sure. You can possible to, because it is online process only.
Only online process.
Yeah, yeah.
Mm-hmm. Okay, okay,
But
okay.
exam you should come UAE because no online exam for
Online
alternative
exam, then.
medicine category. Yeah.
Okay, ma'am.
Excuse
Okay.
me, madam.
Okay. Okay, doctor.
Yeah, I'm from Sri Lanka. I have checked the MOH website. There they have I can remember that they have said as we can sit for the exam online, isn't it, ma'am?
Sorry.
For the exam,
Yeah.
can't we sit online?
No, because in TCM category there is no an online exam, but general practitioners, nurses, that therapists also I think online exam is there. Then also pharmacists, all category online exam is there, but alternative medicine there is no online exam till that July, no online exam coming.
Okay, then we
But
have to travel.
other category, yeah, other all category online exam available. But TCM not yet started.
Then we have to go to Dubai only. Can't go India
Yeah.
also.
No, no, you have to come in Dubai. You have to
Okay.
go in Dubai.
If we fulfill the written exam, if we pass the exam, how long it will take to send our results, ma'am?
So within 1 week, so in nowadays that July 20th exam result came a few days back. So July 29th, so only 1 week. Within 1 week, will give you the result. Some is there any? Yeah.
Then the oral exam will be?
Oral exam after clearing around 10 days. July 20th cleared doctors. They will provide August 2nd week. There will be one viva. But you no need to choose that date because your subject, that Ayurveda subject, Homeo subject also in viva. So if you need to practice, study more, you can choose another date also. Each theory exam after 10 days there will be a viva. Okay, so July 20, August 1st there will be a viva, like that.
Okay, from one.
So according to your
Okay, then
convenience,
by
you
one
can.
visit.
Sorry. According to your convenience, you can choose the viva date. Okay, viva also 3 chances will be there.
Okay, sorry, ma'am, my connection has interrupted. Then by one visit, we can sit both exams, isn't it, ma'am?
Yeah. After getting your theory result, you can after 10 days you can attend the viva.
Okay, thank you very much, ma'am.
Okay, sometimes it will vary because in my exam time, I can say that within 1 week theory exam result come within 10 days viva, but some that Ramadan time or like that some that ministry is so busy time that days will slight variation seeing in nowadays. Okay, also note that. Any other questions?
Mom, what about the Bible questions? Like, what is the model of the exam? I mean, like, how many questions they will ask?
That I already mentioned about that. Here, note the. Sorry. Exam model, is it visible?
No, madam.
Okay.
Hello, excuse me, ma'am.
Yeah. Yes, doctor.
Ma'am, for the application for DHA exam, they are asking the documents that our diploma certificate and degree certificate and all. Is
Yeah.
all certificate should certified by foreign ministry?
No need. For only degree certificate.
Only degree
UAE
certificate, isn't
embassy
it?
attestation only need degree certificate for data flow. That is in data flow process that ministry UAE embassy attestation no need. Just gazetted officer attestation only need for all other certificate. But while you are practicing in a clinic, degree certificate attestation must. Embassy degree certificate attestation. So you can do it before data flow. That's easy. Because for getting labor card, that degree certificate must, attestation must need.
Okay, madam. Thank you.
Okay, so model question paper, that slide already that we discussed. So note that around 100 questions in question paper. That MCQ around 75 questions are MCQ. And remaining 25 mark questions, you can see the note. All 25 is around 5 or 6 picture questions you can see. So picture question, you should write the diagnosis, and you can add some points also, because picture question they are providing around 4, sometimes 5 mark, and some paper 2 mark. Okay, so picture questions are very important. Others are MCQ, and some exam I also see that no pictures, only MCQ, depending upon the that time they sharing the question. So most of the questions are same, around 75 MCQ and remaining 5 picture questions. Okay.
Excuse me, madam.
Yeah.
The degree certificate is authorized by the foreign ministry or the embassy? UAE embassy.
UAE embassy attestation.
Okay.
Mom, what about that good practice certificate?
Good standing certificate in Sri Lanka, were you registered your degree, that registration certificate, no? Register number for practicing, you are doing that process?
Sri Lanka Medical Council, Ayurvedic Medical Council.
Yeah. So Sri Lankan Medical Council, but that's from where you will get the good standing certificate. That's just online process only. You need to upload that original registration certificate to the council and just return for reason for good standing certificate, and they will provide that. We'll share the details about it.
Excuse me, doctor.
Yeah. Yes, doctor.
Yeah. Thank you so much, doctor, for giving a wonderful lecture.
Okay.
And you gave a brief explanation about the course content and all.
Okay,
I think the doctors got an idea about it. And for the doctors, we have another program in coming week about the document flow, data flow. It means how to prepare the Sri Lankan documents for the MOH exams. So you will get a brief explanation in that webinar rather than this. So I think the doctor explained about the course content very briefly. The course will be commenced in coming weeks. If 10 doctors join to the course, we will start the course and all. And we will let you know the course fee later on, because we didn't finalize yet. So if any doctors interested in this course and all, you can contact Aika and they will give you a brief explanation about it.
Doctor,
Yes.
Doctor,
Thank you so much, Doctor.
Welcome. Thank you all. Is there any doubt?
Doctor, hello.
Yes.
If we get the license, is there any procedure to get opportunity to join the hospitals in UAE?
Hospitals?
If we get the license, is there any procedure or is there any opportunity to work in a
No. After getting the license, you can join the clinic, and that just licensing process, evaluation certificate change into that process. Usually doing the clinic for a certificate, licensing certificate. A few days data flow process only. They are usually doing the clinic for you need to pay that amount.
Hello, ma'am.
Yes, doctor.
Ma'am, you mentioned about new exam started for DHA, no?
Yeah.
For this DHA exam, the syllabus is same like that of MIH?
Yeah, syllabus same, but in our separate exam is there DHA, Ayurveda, Homeo. In MOH, all together one exam that mainly focused on practice of medicine, surgery, gynec, that USMLE Davidson textbook. But in oral assessment, in Ayurvedic subject also they are asking, because only oral assessment is there, no theory for DHA. So one doctor clear recently DHA Ayurvedic doctor exam. So she said some Ayurvedic subjects also they are asking in exam.
Okay. Only oral exam.
Along with practice medicinal question.
No written exam.
Yeah, no written exam.
Okay, thank you.
Okay.
Ma'am.
Yeah.
Ma'am, is there any registration pathway like this for medical laboratory technologist? UA.
Yes,
Can you explain a bit about that side also?
Laboratory doctor. That. Yeah, online exam also lab technicians online exam also available. Same that it's textbooks, everything is same only. So many good opportunities in Dubai for lab technicians. And
For
government.
pharmacy.
Yeah, pharmacy.
Technicians also there, no, ma'am. In Dubai.
Sorry.
In Dubai, pharmacist technicians also there, no, ma'am. So can we join to that exam also?
Yeah, but you are in alternative medicine category or pharmacy allopathy? Pharmacist like that, separate for allopathic that I mentioned. So note that in lab technician that we know which course you are studied? Lab technician and pharmacist, many opportunities there, but it is in allopathic sector, not in Ayurveda or Homeo. Pharmacist, no opportunities.
Excuse me, ma'am. How can we get the past papers for DHA exam?
Sorry?
How can we get the past papers, the previous past papers?
Yeah, I will provide everything in from TRIMF. We have up to 20th July 20th recently conducted exam questions, and before 3-year experience, 3-year or more. Many questions are providing from TRIMF because many doctors are cleared already. So we'll share all question paper. So note that question paper they are writing in paper or in typing in like that only, because we didn't get back the question paper. Okay, remember, because many doctors are clearing from third attempt, so most of the previous questions are repeating, so they know about the question details, so they are writing and sharing the questions. Many questions are there. Will provide everything from Trump.
Ma'am, I'm from Kerala.
Yeah.
And I'm very interested to join in Triumph. How can I contact you, ma'am?
You can contact Alka.
Okay.
Ma'am, so if we pass our examination and everything is fine, within how many months we have to like join a clinic? Join to a clinic. I mean, like within 6 months.
Yeah, Ayurveda doctors. Many clinics are. You are Ayurveda or homeo?
Ayurveda.
Yeah, Ayurveda. No need to think that after clearing exam, they will contact you. That many clinics are opening, so you can join that clinic. Because now only I have got some queries. Is there any doctors are clearing new Ayurvedic clinics are opening? Please give the number like that. So no need to worry. After clearing after clearing theory examination also, some clinics are calling and give that clinic for doctors. So after clearing exam, they will contact you. Then you, after clearing Viva, you can join that clinic. So in our clinic also, they need Ayurvedic clinic doctors because some doctors are getting more salary shifted in many, usually going like that. So according to your experience, you will get more salary and more clinics are waiting for you.
Because if we want to come back to Sri Lanka, so what will be the minimum joining period? That's why I asked.
Sorry?
If we want to come back to Sri Lanka,
Yeah.
so after doing exam, what is the minimum period?
Oh, minimum period. You can, according to your convenience, you can choose that. If you don't want to need immediately in clinic, that I cannot predict that because many opportunities are there in Ayurveda. Clinics are opening. So if you need to join immediately, you can join that clinic. I will also inform you after clearing if there any vacancy. Or sometimes clinic also you are registering any online some clinics like that. They will call you and you can attend the interview and immediately you can join the clinic, or you need some time period, you can come back to Sri Lanka and go there.
Okay, ma'am. Clear, because in pharmacist exam, they are telling that minimum 6 months we have to practice in a pharmacy. Likewise, there is no any condition for Ayurvedic doctors.
Okay. Welcome.
Thank you.
Welcome. Thank you.
Excuse me, ma'am.
Yes, doctor.
Yeah. For how long it will take for the process, ma'am?
For data flow?
Yeah, from the data flow to taking
around 2 months because they need to, for data flow, for experience they need to clarify that you are working their clinic or not. So sometimes they will read the clinic and sometimes they mail the clinic manager or call this doctor this time period working your clinic or not. So they need to confirm that immediately. Then around 2 months will take for data flow according to their verification, everything. Okay. Yes. Are you active?
Excuse me, ma'am.
Yeah.
Ma'am, as you mentioned earlier, if there's three certificate we must fulfill, no?
Yeah.
The degree and the 2-year experience also. Now we haven't government jobs yet after our convocation after 4 years. But I conducting my own clinic, private clinic. So how we get cover this 2-year experience document?
So
And
no, if your friend, so your own clinic, no?
yeah.
So no, no issues. It's because your friends or any other doctors also working there, no?
Yeah.
Or you only?
Oh no, I'm only.
You are only so no one will come Sri Lanka and checking that. You can give another name, and when you get the mail, you can give your name and clinic address, everything. So
Yeah.
getting the call, you can say that this doctor working here for 2
Yeah.
years, and you can say that time period also.
Yeah. Okay. Thank you.
Just confirm.
It's value the business certificate in Sri Lanka.
Sorry.
I conducting in my own clinic. I have a business certificate to that clinic.
Okay.
So we can show that.
Oh no, no problem. 2 year will share one model of that experience certificate to Dr. Sajja. You can.
Oh no issue. No issue in government jobs. No, it's
No,
okay. No.
problem. No problem. No problem.
Okay. Thank you.
Okay. Welcome.
Ma'am,
Yes, doctor.
do you have post internship experiences?
Sorry.
As post experience, post internship experiences, should we have
Yeah.
post internship experiences
Sports.
as
Because your voice is not clear, doctor. Sorry, I
sorry,
couldn't get.
I'm currently not in.
Okay.
Well, sorry, can you hear me well?
Okay.
Hello, doctor. Can you hear
Yes.
me well?
Now I am hearing. Can please tell?
Should we have post internship 2 years experience?
So no, doctor. After internship, when you get that convocation degree certificate, from that date or to you can start the experience after internship only. Okay, convocate the degree certificate date, no? From
They
that
consider
date to 2 year, 2 year.
from that day. Yeah. Thank you very much.
Hello, ma'am.
Yes, doctor.
Hello, ma'am.
Yes, doctor. You can say.
Ma'am, I complete my internship
Okay.
last December to
Okay.
2021.
Okay.
So
So
from that
if
date,
you can apply for
from that
data flow 23 only, because 2 year experience.
23 only. Okay.
Yeah.
Okay, madam. Thank you.
Okay.
Excuse me, madam.
Yes, doctor.
Shall we wind up the meeting? Because the
Yes.
meeting is limited for 1 hour. So
Okay.
it will be automatically wind up.
Okay.
So to avoid the discomfort, we can wind up the meeting. Thank you so much, doctor, for your brief explanation, and you have answered for our doctor's question very patiently and briefly. Thank you so much. And is there anyone to give testimonials to, doctor? Is there any feedbacks to give?
Sorry?
I am asking other doctors to
Yeah,
feedback
okay.
about your lecturing. Is there anyone to give any feedbacks and suggestions about this? You can give
Yeah.
or thank our doctor
Yeah.
and
Thank you very much, doctor, because we had a lot of questions and our other colleagues also had a lot of questions, and you clearly mentioned all the doubts, our doubts, and all clear. So a big thank you.
Thank you, ma'am, to share the valuable feedbacks. Yeah, anyone? The chat box also, there are a lot of people giving the testimonials.
Okay.
Okay, thank you, doctor. Once again, I thank you to deliver such a wonderful session. Hope all the doctors will join with us to get a better future in Dubai. Thank you so much, Dr. Anju Priya.
Thank you all. Welcome all. Thanks, Alka, for giving me the opportunity. Thanks a lot.
Thank you.
Bye.
We'll wind up the session. Thank you so much for other doctors also to participate in the webinar. Thank you.
Hello. Hello, can I speak to Aika, the organizer? Hello.
Meeting will end.